Gauteng Health Department is reportedly facing a staffing crisis in public hospitals, with posts allegedly being frozen due to budget cuts. According to the Democratic Alliance, patients could face a healthcare disaster and some doctors and nurses may not receive their salaries by December. The department has acknowledged that it faced a shortfall of more than 500 million rand in its employee budget as a result of last year's wage agreement, which was not fully funded by Treasury. Gauteng's Health Deputy Director General, Basani Baloyi, now joins us for this conversation. Basani, a very good morning to you. Thank you so much for making time for us. Is Mr. Bloom right in arguing that the department won't be able to pay salaries or all salaries in December?
Good morning, Aldrin, and to the viewers. First, I would like to correct that we're not in a crisis and there is no such a thing that we won't be able to pay salaries.
Okay, so what's your understanding then of the 500 million rand shortfall in employee budget?
When you look into the compensation of employee budget, it covers a lot of, budget items. For instance, committed as well as normal overtime. It covers, gratuities. It also, covers, employee incentives. So what happened is that we have, since the beginning of last year, prioritized, critical positions, and those are clinical posts. So we filled most of the clinical posts as we took a patient-centered approach. However, we still have got to fill some of the clinical support posts, which are, posts such as cleaners, in a ward, porters, laundry workers, operators. So those are the clinical support posts that most of them have been recently vacated. And we also need to correct that the clinical posts are not frozen. And the freezing of posts is not done by the Department of Health. So when we look into our expenditure to date, we decided to relook into our position and requested all facilities not to fill the positions so that, we can go back to the drawing board and fill those that are critical and those that we've got funds for.
Okay, so which posts are frozen?
The posts that are frozen are non-clinical posts.
So the non-clinical posts are the ones that are frozen. So these would be the cleaners, right?
This will be the cleaners. This will be the senior management post in administration. For instance, your chief operations officer position, your chief financial officer position, your chief directors, and other support functions. But all our clinical posts are not frozen. What we did was to relook into our expenditure, and so that, we ensure that we do not actually, overspend, and also appoint a lot of staff that we cannot pay. So the clinical posts are not frozen as we speak.
So earlier on when we started off, you said you wanted to clarify that this is not a crisis. A 500 million rand shortfall in your employee budget, clinical, non-clinical posts that have been frozen, including the cleaning staff, which of course speaks to the cleanliness of hospitals. You've heard what Tom London had to say about the state of the public hospitals, major complaint that has been raised there, and how he felt that people were being treated as cockroaches. On top of that, the Ombudsman yesterday told Parliament that the majority of the complaints are coming from Gauteng. The top 10 complaints are coming from the top 10 hospitals in Gauteng. Now, how is that not a crisis?
Being in the top 10, actually, it's a reality because Gauteng is the biggest, province. We've got more hospitals. We are the only province that has got four academic hospitals. We've got 85,000, employees. So when there are challenges that we do face, but we have also put measures in place because of we receive grants that we have also used in terms of complementing our staff. The reality is that, you know, we now have a lot of patients that we never anticipated, you know, in our system, because of we also cater for the neighboring provinces. We also cater for patients that are coming from SADC. So our resources are overstretched to start with. Hence, you know, we need more staff members, you know, to can be able to meet, you know, the needs of our patients. But as to call it a crisis, that is not really true. We are now facing the crisis in the sense that we have got more patients than we anticipated.
What's
no
your
one saw the
definition,
influx of.
Basani, what's your definition of a crisis?
When we say in a hospital environment, when we say we've got a crisis, it's whereby you are saying that, for instance, we are unable even to actually treat our patients. We are unable to do, you know, basic, you know, patient care in a facility, and we are not there.
Okay, so the delay in treating those patients because of the long queues, you spoke now about that you need more staff members. Surely that does have an impact on how you are able to provide a service. So you would say that that is not a crisis, even though, again, the majority of the complaints, as per the Health Ombudsman, are in Gauteng.
We do not dispute that we've got complaints, but as I'm telling you, Adrian, we've got more patients than anticipated. And we are also worried about our healthcare workers because they are seeing more than what they are supposed to do in terms of norms and standards. You know, they have to work longer hours. You know, they are facing, you know, fatigue. And that is what we can say it's one of the major problems.
Okay. With the longer hours, are you able to pay for overtime currently?
For our clinicians, especially, you know, the medical officers, your registrars, you know, your heads of clinical departments, as well as clinical managers and heads of clinical units, they are paid committed overtime.
Okay, so where are you not able to pay for overtime?
We are paying overtime also for support services that are, you know, working overtime, as well as nurses, you know. But however, that number, that budget that we use to pay now will go down because we have appointed many nurses in the past 2 months.
Okay, so you're saying that you do have a budget for overtime. And I'm also asking this question based again on what Jack Bloom had said. And I'm also taking into consideration that we're going into the festive season and we know that the number of car crashes increases over that period, and there's a lot of pressure on the public hospital system to deal with some of those emergency cases. So you do have a budget for overtime.
Yes, we do have a budget for overtime.
Okay. In terms of the vacancies that we spoke about earlier on, what's the number standing at?
The vacancies are across the system. The positions that we wanted to fill is just over 1,100.
1,100?
Yes, and majority of those are cleaners, laundry workers, porters, admin clerks, and data capturers.
Okay. Have you had the conversation as yet with Treasury to release more funds for Gauteng Health?
We are going through, we are preparing for the Premier's Budget Committee meeting, and we are going to present our case.
Okay, thank you so much for your time. Dr. Basani Baloyi there. She is the Deputy Director General for the Gauteng Health Department